let's begin with the numbers. Let's look at the first dashboard. Hospitalizations down to 5. It's hard to remember when we had 5 in hospitalizations. That's a pretty dramatic number, and it's a number that really does stand as a measure of what this community can do when it stays disciplined. I know I harp way much on wearing masking and social distancing, but the only difference between this number 5 and where we were back in June with numbers that were going up is that kind of behavior. The virus is no more or less infectious. It's that we're doing a better job, not just one of us, but so many of us. If the virus doesn't have the opportunity to jump from person to person, it just can't jump. So 5 hospitalizations, great number. 7-day moving average is 14. Look at the right side of that graph. You can see 142 cases today. That number is higher than our 7-day moving average of 128. We talked about this yesterday. That number is higher than what we had been seeing, and that could mean several different things. It could mean that the number of cases are going up in reflection of Labor Day, students coming back, 40,000 people that showed up in Austin as guests when the hurricane hit the valley and the Gulf Coast. It could be those things. We also have gotten a dump of information from the state, and it looks like we're now getting cases that might have arisen. They've been tested 14 days ago. So again, the data is imperfect with respect to cases. We're struggling to make it as real and as meaningful as we can possibly do. But it's one of the reasons why your city, recognizing that might eventually be the case, chose to rely so much on hospitalizations because we knew that was a more objective number. But in any event, the cases are going up, and the cases could be going up without hospitalizations going up. If, as we saw is the case yesterday, the bulk of new cases in our city are young people between the ages of 10 and 29. We're trying to check right now to see that 10 to 19 number to see if that's high school students or middle school students, new students in college. So we're trying to learn more about those numbers, but it looks like a younger population is getting it. That younger population does not translate into hospitalizations the same way, but we need to watch that because those younger people are just as infectious and they can pass the illness on. These numbers are good. If we can keep these numbers down, we can continue to open up the economy and sustain it, continue to bring more people into our schools. And that's the advice and kind of suggestion that Dr. Escott is sharing now to make sure that those opportunities exist so long as we maintain the discipline in the community. Let's look at the second page on the deal, on the dashboard. 74 people tonight in the hospital. That's also is a low number. The 7-day moving average is 89. 29 people in the ICU, 7-day moving average 35. 14 people, low number on ventilators. 20 is the 7-day moving average. So those numbers all come down, recognizing that the cases we're getting now are disproportionately younger people, which are not ending up as much in that situation. We should be proud of what we've done. We also have to remind ourselves constantly that many other cities have gotten to where we are right now, only to see their numbers go back up because people think we have this thing licked, it's gone away, the virus isn't here anymore. None of those things are true. 413 people passed away. That's one more person than yesterday. Always important to recognize that number.